With us now is Jeffrey McQueen. Welcome to the show, Jeffrey. How are you?
Very well, thank you, Donna. Thanks for having me.
So today we're going to discuss mental health. What does that mean to you as the executive director of a mental health organization here on Long Island?
I think what that means is that we have to be a little more attentive to how trauma affects our community and what is the result of that trauma in the community. Most people think about chemical imbalances and things of this nature, but how does that happen? And so I think it's important to know that our community, particularly today in this time of unrest, having dealt with COVID and social injustices and the way racism just spoke out to us, that these affect our community in ways that exemplify itself in, depression, excessive use of drugs and alcohol, and things of that matter.
Growing up, you had some trauma in your life, but you changed it all around. And now you're a champion for others.
So I think that there are two ends to the results of trauma. Most people, and here's a good example.
Okay.
People that deal with depression will drink when alcohol is a depressant. So it's not uncommon for us to experience some trauma and then use something that is equally traumatic to try to deal with the trauma. The other side of that is that people just will not drink at all, right? And so what I learned was that my present situation didn't have to be the final destination, that even though I chose a pathway that was more traumatic for me, that it didn't mean that I had to live there and stay there.
Okay. So now you're a champion and you're doing amazing things. So you're the executive director of an organization that is trying to help prevent suicide,
That's correct.
drug abuse, suicide by drugs.
Mm-hmm.
Have you lost someone special to you? Like what happened, Jeffrey, that you said this can't keep happening?
So having overdosed twice myself, and fortunate not to have passed, and having known, I can't count the numbers, but probably well into the 50s to 70s of people throughout the course of my recovery to overdose and to suicide, right? To death by suicide. I just decided that there has to be more of a voice in the community that has that lived expertise, right?
Because you've walked those steps.
Because you walk the steps, and it's easy. Listen, I've talked to, even today I do a group at the county jail. And it's so easy for someone to be textbook and say, oh, you shouldn't do this and this is what you should do. But if
I'm only laughing because you're absolutely right.
Well, I mean, it
right?
happens, right? We have so
people
many
will be like, they have
clinicians
book sense, but they might not have every day
and
on the
I think
ground.
that's where we fall. I think that sometimes there are those individuals in our community that are struggling and they're looking for someone to say, I've been in this hole with you and I know the way out, right? And that's what I think we bring to the table at the Mental Health Association.
I'm hugging you even from the distance right
Okay,
here.
I'm
Did you
hugging
feel
you
it? Do you
back.
feel
I'm
it?
hugging you back. I'm
I'm
hugging you
like
back.
hugging you at this moment. What is the first step for someone? What is just one little step? Is it making a call to a 1-800 number? Is it going to a preacher? What is that step where somebody says, help, I need help and I can't do this alone? What is that?
I think the first step is information.
Okay.
Right? I don't think that anyone has a map. This is like raising a child.
Right.
We have children and we don't know what to do, right? There's no manual on raising a child. So I think that what we do in that case, we begin to ask people who've already raised children, is this normal? Is that cough normal? Is that birth right? So I think the first line of defense when it comes to substance use disorder or mental illness is information.
Okay.
Learn
like
the
that.
language. Let's talk about it, right? Because I think that when we begin to identify that nothing is wrong with anyone, that things have just happened to people, then it changes the culture and it also helps to remove the stigma.
Thank you for that. I know you have an event coming up But
Yes.
so that this is evergreen, so that it'll support that upcoming event and many upcoming events. With your permission, I'd like to send them to your website
Definitely,
because it will
please.
be there, right?
Yes, it
So
will.
what is that website one more
That
time?
website is www.mhanc.org.
Beautiful. And even if they're not in this community and they're living somewhere, anywhere in the world, they could still reach out
They
to
can
you
definitely
to get some
support.
help.
Yes, they most certainly can.
Thank you, Jeffrey.
Thank you very much.
It's a blessing to have you here today.
It's a pleasure to be here.
Thank you so much. If you are struggling or someone you know is struggling, please reach out to them. There is help, there is hope, and we want to make a difference, and we need you to make a difference in our lives as well. Thank you for watching.